One thing about the lack of wind is that when I crest Edinburgh Drive and I look down on the City Bowl for the first time on my journey from home to work, I see that really quite toxic looking brown cloud that hangs over an increasingly large part of the City Bowl to the east, to the west, out into the Atlantic Ocean and so on. And I do wonder what's in that and what impact it has on people's breathing apparatus when they breathe that in. And there is a recent environmental health study out of UCT which finds that almost half of Cape Townians are at risk from air pollution. Dr. Meryl Jagarnath is the lead author of that study and a lecturer in the Division of Environmental Health at UCT School of Public Health. Meryl, good afternoon. Thank you for your time.
Good afternoon, John, and good afternoon to the listeners.
What's in the air that is that is putting the public health at risk to the degree that your study finds it is?
So mainly with air pollutants, there is a whole host of air pollutants, but what we found in our study that it was mainly carbon monoxide and particulate matter under 2.5 micrometers. So with carbon monoxide, that's basically from vehicle emissions, which is obviously also not surprising, given Cape Town and the traffic. And also industrial emissions, things from the shipping as well, that also emissions from ships as well, and domestic burning, that's household fuel burning, and then also from forest fires that also Cape Town is known for. And with particulate matter 2.5, so that is also the same sources as well, vehicle emissions and fuel burning. But what's a concern, especially with particulate matter 2.5, is that in Cape Town, it exceeds the annual average from the World Health Organization, which is about 5 micrometers. And so this is exceeded annually, and sometimes it also, with some parts of the city, actually reaching over 10 micrometers of particulate matter 2.5.
Is there anything, Meryl, about the way Cape Town is laid out and the presence of mountains and so on, proximity to the sea, wind factors that makes it so bad? Because I know we have bad traffic, but so does Durban, so does Johannesburg, and I don't know whether similar studies have been done there. Maybe if the studies were done, they would find that there would be an equal or worse problem in those cities. But is there something about where the city is and how it's laid out that makes this situation as bad as it seems to be?
So firstly, in our study, we basically found that overall, Cape Town has actually moderate air quality, but there are some areas in Cape Town which experience consistently poor air quality, and our study was done over a 5-year period. So from 2015 to 2023, that we looked at air pollution, citywide air pollution, and we found that it has improved slightly after 2020, but there are areas which are consistently experience air quality that exceeds the World Health Organization standards.
And are those areas where people are burning things in
Yes,
their homes for heat and for cooking and so on?
yes, it include those areas as well, and also they are located near the N2, for example, along the Cape Flats that we found. Areas like Kailicha, Crossroads, Philippi, Guguletu, that has high exposure to air pollution. And this is also compounded by the fact that they have high vulnerability. We found also the residential areas near the airport as well. And also we found along the Southern Peninsula, due to forest fires there as well, that there is high or poor air quality. And so, I mean, if you have to also think about the way Cape Town is also laid out with the mountains to the east and to the west as well, it does create a basin that, where air pollutants actually stay at the surface, especially during winter when you have the inversion and the brown haze as well. And with summertime, although we do have the southeasterly blowing in, the amount of fires that we have as well contribute to having poor air quality as well.
And how dangerous is the poor air quality that we have? You say that roughly 1.9 million inhabitants of Greater Cape Town are at risk because of this poor health quality. Is it something which degrades their personal health by 10%, or is it more serious than that? I mean, does it risk people with particular vulnerabilities maybe developing life-threatening conditions which they wouldn't have developed if they were not living in an area of poor quality? How big is the public health threat of this?
Yeah. So specifically in our study, we haven't looked at the health response or the epidemiological evidences yet, because this is more kind of characterizing the exposure, looking at in Cape Town where and who are the most impacted by air pollution risk. And so just looking at, studies that that are done on air pollutants, it's associated with a higher risk of, respiratory diseases, asthma, cardiovascular diseases, heart disease, and even some cancers as well. So that's generally, the risks that are associated with air pollution. But also to note that overall, we do have a moderate air quality in Cape Town. And what's important is that we do have these areas which actually have consistently poor air quality. It's, the 40% of the population, 1.9 million people. And actually in our map, in our work, we've actually mapped it as well. And then you can see it's, specifically 61 wards that experience this poor air quality.
Thank you very much. We didn't get into what the city could and should be doing to improve that. Perhaps that's for a follow-up discussion. Dr. Meryl Jagarnath is a lead author of the study we've been talking about, a lecturer in the Department of Environmental Health at UCT.